What does that say? That says, let's make a virus that selectively inhibits the T-cell system of man. And of course, what is that virus? That virus is AIDS. So, is it a mere coincidence that we now have a pandemic of a T-cell destroying virus, which was in a sense predicted, and here requested, growing in Africa and the United States? Now, this question was addressed partially in an article written Monday, May 11th, 1987. And in that article, in the front page of the London Times, which addressed the question of, was there an association between the WHO vaccine programs in Africa and the outbreak of AIDS? Their conclusion was the following, that there was an association. Well, the story goes like this. Supposedly somebody had been hired by the WHO to investigate whether or not the WHO vaccine programs in Africa, the W.H.O. meaning the World Health Organization, which were the WHO vaccine programs which were responsible for eradication of smallpox in Africa, may have been a contributing factor to the spread of AIDS in Africa. Evidently, a researcher who has remained anonymous, is afraid to reveal his name, was hired by the World Health Organization to investigate that study. He did a study over a year or two. He wrote a report. He submitted it to the World Health Organization. The WHO was paid, and that was the end of it. A year or so later, he walks in to the London Times and throws the report on Pierce Wright's desk, who is the science writer at the London Times, and said, if you really want to know what's going on with AIDS in Africa, here's the answer. That article was the impetus for the printing of this story, which said there's a correspondence between the WHO's program in Africa and the outbreak of AIDS. As far as we know, this has never been discussed or addressed in this country. And I find that particularly interesting as to why it's never been addressed in the United States for the following reason. A quote in that article on Monday, May 11th was from Dr. Robert Gallo, who is the reported co-discoverer of the AIDS virus, who said that this was an interesting and important hypothesis. An interesting and important hypothesis. Well, if it's interesting and important, how come nobody's addressing it? Obviously, in a sense, the answer to that might be, if you made AIDS, would you tell anybody? Of course not.